In your interviews, try and bear in mind that you're always trying to demonstrate 3 key qualities: awareness, balance, and reflection. Do you know what the key challenges are facing the National Healthcare Service? Hey everyone, I'm Katie, a medical student and one of the presenters here at the Aspiring Medics. And today we turn our attention to one of the most important, and indeed one of the most commonly asked medical school interview questions. What are the key challenges in the NHS, and how can the NHS evolve to address those challenges? So in today's video, we're going to be going through 5 key challenges facing the NHS and the strategies that it can use to evolve and improve for the future. So the first challenge we're going to explore, and perhaps the most visible, is the surge for demand for NHS services. In the UK, we're facing both a growing and an ageing population, and this is putting additional strain on the NHS resources. This is due to the fact that as the population ages, there can be an accumulation of those chronic healthcare conditions, including diabetes, dementia, and hypertension, which require a long-term, complex, multifaceted approach. This creates a perpetual demand on the NHS services compared with more acute cases where a patient might have 1 or 2 days of treatment and then go home to live a more healthy life. Following on from this, it's important to consider the fact that the perpetual demand for services is elevating the waiting lists. It's estimated in England now that over 7.5 million people are on the elective treatment waiting list, so that again puts further strain on those NHS resources. In your interview, you could address this question by talking about how the NHS is facing an escalating burden of chronic healthcare conditions coupled with an ageing population, and this has led to unprecedented waiting times and poorer outcomes for patients, and we need more evolution in the NHS to address this. To then elevate your answer further, you could link it to the direct impact on patient care. You could talk about how the surge in demand often leads to delayed diagnoses, poorer outcomes, and then patients requiring more emergency services due to the delayed diagnosis. So that puts additional strain on all measures in NHS, going from GP all the way through to the tertiary hospital services. You could also broaden your analysis further by talking about preventative medicine and its role of helping to reduce the demands on the NHS by promoting early and opportunistic screening and reducing the demand at its source, encouraging early treatment and preventative medicine. So in your answer, you're not only drawing on your knowledge about the challenges of the NHS, but also demonstrating your ability to think forward and reflect on cause and consequence in your answer. So the second challenge that the NHS is facing is one related to people, or rather lack thereof. The NHS is facing a critical workforce shortage. Tens of thousands of vacancies exist across medicine, nursing and allied healthcare professionals, and this has led to a knock-on impact of staff morale as staff are overextended, and burnout has become alarmingly common. In your interviews, this is an excellent opportunity to showcase your empathy and understanding of the core issues. You could phrase your answer like, the NHS depends fundamentally on its people, and issues like burnout, difficulty in retention and recruitment all have a knock-on impact on staff morale and increase the strain on the NHS resources, which leads to adverse patient outcomes. To add depth, you could also discuss about the nature of the problem and how interconnected it actually is, where burnout leads to attrition then leads to the shortages, and the shortages have a knock-on impact of that burnout and creates other problems for the NHS. You could also elevate your answer further by talking about the potential strategies to combat this and improve the situation. This would involve encouraging increased workforce placements, flexibility with training, and improving mental health awareness and mindfulness classes or courses within the NHS to try and support staff as much as possible. So the answer draws not only on your ability to reflect on the problem as a whole, but also your understanding of the potential solutions and how you can link that into your interview. Although the NHS receives substantial government investment, it's important to bear in mind that demand often outreaches the resources that are available. The high cost of intervention, the cost of maintenance of the infrastructure, and also the increasing burden of chronic healthcare conditions on the NHS puts immense strain on those budgets that are available. In your interview answer, you might want to phrase it like, the NHS operates in a continual fine balance between limited resources and unlimited demand. Financial constraints, delayed discharges and bed shortages all create additional strain on those resources and lead to a system that's often working at beyond its intended capacity. In order to elevate your answer further, You could talk more about how the NHS is functioning in a broader ecosystem, for example about public health, social care and preventative medicine, and link those into your answer to demonstrate that you're thinking more as a doctor and not just from a student's perspective with the hospital more clinically limited awareness of the fact that it's more of a social issue as well. You could also talk a bit more about the social aspect of the constraints on the budget. For example, insufficient social care and support leads to bed blocking and delayed discharges as patients are unable to be discharged into an environment that's unsafe for them due to a lack of community support being available. So linking all of these factors into your interview and making sure that you touch on them can lead to a really solid answer, which demonstrates that you're thinking more as a doctor, encompassing all the different social aspects in your answer, not just about the clinical side. The fourth challenge is both ethical and practical, involving the equitable access to healthcare services. So in the UK, the NHS was founded on the key principle of being free at the point of delivery and accessible to all. However, the reality does remain uneven. Geographical variation means that rural and more deprived areas face fewer GPs, decreased access to specialist services, and much longer wait time for emergency services like ambulance provision. It's also important to consider the social determinants of health, and to name but a few, including income, education and housing, and the knock-on impact that those factors have on perpetuating health disparity in the UK. In your interview, you could phrase your answer as, I know that the NHS has the founding principle of being free at the point of delivery and trying to provide equitable access to healthcare for all. However, the reality is uneven and there is health disparity in the UK. Those from a more rural background or more deprived background may face higher morbidity, poorer prognoses, shorter life expectancy, and greater difficulty when accessing NHS treatment. Ways that you can elevate your answer further in the interview is to try and talk more about solutions and try and always link back to those patient-centred outcomes. You could talk about how improving targeted delivery of primary care and preventative medicine in more deprived areas, talk about the use of telemedicine to bridge rural gaps, and also try and talk more about improving health literacy on a population level to encourage equitable access to healthcare. At its core, your answer should always have a patient-centred focus, because that is at its heart what medicine is all about. It's not just a science, but it's also a service provided to everyone, and it should try and uphold fairness and be equitable for all. So the final challenge, and also a great opportunity, is innovation, integration, and the future of healthcare. So the NHS is becoming profoundly digital with the integration of electronic patient records, the increasing use of artificial intelligence in our healthcare, and the increasing uptake of telemedicine and virtual healthcare appointments in the NHS. However, there are some obstacles with this that are important to consider. The costs, data security, interoperability, and perpetuating further healthcare disparity, as many disadvantaged or elderly populations may feel that they're getting left behind in the digital transformation. In an interview, you could try and phrase your answer that the NHS must modernise in order to remain sustainable. Increasing innovation can help to improve efficiency and safety of patients and improve patient outcomes. However, we must be able to safeguard patients' trust in the NHS system and encourage equitable access to healthcare and ensure that no population gets left behind. In order to sound even more polished, you can talk about how it's important that we think about integration and not just innovation in itself. That involves integration between primary care and secondary care, along with the innovation and the digital side of healthcare, and also the integration between community services and healthcare services and how they all operate as one broader healthcare system. Interviewers also like it when candidates acknowledge that innovation in itself is not a challenge, but it's the integration between innovation and traditional medicine that's really important that the NHS masters in the coming digital era as things become even more modernised and innovation increases further. So to summarise everything we've talked about today, the 5 great challenges that the NHS are facing is 1, the rise in waiting times and demand on resources. Secondly, the workforce shortages and burnout. Thirdly, financial constraints and limitations on capacity. 4th, healthcare inequalities and access barriers. And lastly, about innovation, integration and the future of healthcare. In your interviews, try and bear in mind that you're always trying to demonstrate 3 key qualities: awareness, balance, and reflection. Awareness is that you understand the key issues and challenges that the NHS are facing. Balance is important as it demonstrates that you're thinking about the consequences of the challenge, but also balancing that with potential solutions. And lastly, reflection is really critical for this. Reflection is all about thinking, drawing your answers back to the patient, explaining the impact of the challenges that it might have on the patient experience and journey, also reflecting on your own work experience or other factors that can help you with responding to those answers, and lastly, about how reflection is important when you're thinking about why doctors should know about these key concepts. And that's all, everyone. Thank you so much for watching the video. I really hope you did find it useful. If you did, be sure to check out our other videos on our channel and be sure to like, share and subscribe to the channel for more content like this. If you have any questions, feel free to drop them in the comments below, or likewise if you have any of your own experience to share, that would be greatly appreciated. And remember that when you're addressing challenges in the NHS, it's not about what the NHS faces, but why it's important for the people that it serves. Thank you so much for watching the video. See you guys!